The number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes and wash your hands thoroughly and frequently as we all strive to stop the spread of the virus. Welcome to InfoHub for Wednesday, May 6. Thanks for joining us. The national recount of votes cast at the March 2 general and regional elections began today at the Arthur Chong Conference Center. Felicia Valenzuela was there and brings us that report.
The national recount of the March 2nd, 2020 general and regional elections here in Guyana got underway earlier today at the Arthur Chong Conference Center just behind me. But before the actual recount started, there were some delays, as we heard from Minister of Public Infrastructure, David Patterson.
First thing that I observed is that they relocated. We initially, when I was here, I think it was Saturday, we had the particular booths and areas were allocated for different districts. When we went there this morning, they've changed that around, and they also increased marginally some of the amount of persons that can be in each booth. The problem that happened is that apparently the PPPs could not find the keys to for their chains, so they just finished cutting the locks, the PPP locks off of it. I hope that doesn't cause any controversy, but everyone was there, and I think I saw the PPP agents. They themselves gave someone the bolt cut for that.
Later on, we were given a briefing by Public Relations Officer of the Guyana Elections Commission, Yolanda Ward, who told us exactly what took place this morning.
Got off to a bit of a late start this morning. Of course, with the security system that is in place, ensuring that every person, every vehicle who enters the Arthur Chong Conference Center, that they go through a detailed security check. And of course, as you know, this is based on our experience, as happened at the Ashman's building during that period. We also had a delay where a party could not locate their keys for the containers. Eventually, we had to, with the permission of the party, use the cutter to cut those chains. We also had a situation where there were two unknown chains on a container. I think it's from the Region 3 container. No party owned those locks and chains that were on the container, and so we also had to resort to cutting that. Also, I should let you know that in one of the containers that we opened, I think it has ballots from Region 1. What we found was that one of the ballot boxes was filled with water. What happened there is that upon inspection, we found that the container it was stored in, there was a hole right where that box was stored, and apparently from the rain and so on, water would have gotten into that particular box. It's just one box. We are making arrangements to ensure that that is corrected, and of course it will be for the Commission to determine how we move ahead as it relates to that one specific box, which was from Region 1.
The order for the national recount was gazetted on Monday, making way for the national recount to actually take place. I'm Felicia Valenzuela, with the senior videographer Paul Bridgemahan from the Arthur Chong Conference Center.
As the public healthcare system remains in a state of preparedness, a COVID-19 maternity unit has been established at the Georgetown Public Hospital Corporation. Delicia Haynes tells us more.
This is a special quarantine isolation unit for pregnant women who are suspected to have COVID-19. Nalini Prasad Duncan, Junior Departmental Supervisor of the Maternity Department at the GPHC, said this is to ensure that a possible COVID-19 case does not put staff and other patients at risk of contracting the virus.
Once we have a suspected case or a confirmed case, the patient is given a mask, right, and they're being placed in our area set aside. Swabbing will be done by the trained professionals. And as I said, we have a hard-working team who are volunteered and willing to work with these mothers.
This unit is equipped with all that is needed for a pregnant woman who has tested positive for COVID-19 or is a suspected case. This includes oxygen tanks, masks, and even a special delivery room. The equipment needed for preterm deliveries, such as an incubator, are also in the unit.
We don't want the public to be afraid that, okay, there will be nurse with other patients. We have them set aside, as well as we want to make their mothers comfortable as possible, along with working for safe delivery for the mother. So once our mother would have delivered, we treat them from admission until delivery.
Meanwhile, pregnant women are encouraged to take all the precautions and follow guidelines issued locally to protect themselves from contracting the virus. Health centers have been actively preparing mothers for delivery as usual. The public health facilities have upped the ante to ensure both mother and baby are protected amid COVID-19. For InfoHub, Delicia Haynes.
As at May 5, 27 persons have been medically cleared and have since recovered from the coronavirus. The number of COVID-19 related deaths now stands at 10, with a new case recorded. There are now 93 confirmed cases. Look out later today for our daily COVID-19 update on our social media and website. On the oil front, Director of the Department of Energy, Dr. Mark Bino, during a virtual media conference earlier this week, provided key updates on the oil and gas sector. Here are the details.
During the meeting, the Energy Director disclosed that the department continues to work towards strengthening its institutional capacity.
The Department of Energy has contracted the services of a petroleum accounting specialist and has been working to secure the services of a contract administration specialist, a subsurface engineer, and an oil and gas advisor to the director of the DE. The DE continues to work assiduously to build out its structure for more efficient management of the sector.
Dr. Bino highlighted that since its completion, the local content policy has been implemented.
The local content policy has been completed and is now being implemented, and we continue to look at various areas for enhancement and improvement. As we said, this remains always a live document, and it will continue to be enhanced as we move forward.
The media was also provided an update on the LISA Unity FPSO. Its completion is on schedule.
The topside fabrication is progressing well, with all 19 modules under construction. Several trees and tubing heads have been completed, with the first couple of trees being shipped to Trinidad and from Brazil. Development drilling has commenced, as well as the installation of risers. This project remains on schedule.
For InfoHub, Stacey Carmichael.
More news after this short break. Stay with us. The following is an important message from the Ministry of Public Health. You can prevent the spread of the COVID-19 virus. If you have the following symptoms: coughing, fever, or difficulty breathing, please stay home. If you don't have these symptoms, then practice social distancing. Avoid crowds. When in a group, keep a distance of at least 3 feet between yourself and other persons. Please wash your hands with soap regularly or use hand sanitizers. The Ministry of Public Health has a hotline to provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067. Welcome back. Let's tell you now that the Guyana Tourism Authority will focus on addressing the recovery of businesses in the sector affected by the COVID-19 pandemic. Neola Damon has more.
This was disclosed on Monday by the new director of the GTA, Carla James Chandra, during a welcome ceremony for her and farewell for the former director, Brian Mullis.
In the next couple of weeks, I think GTA is going to be focusing on helping the sector through this difficult period, preparing for recovery. Our team will continue to invest and build capacity in the GTA so we can be a strong support for the stakeholder.
She added that among the topics to be discussed in the coming weeks will be assistance for small entrepreneurs working in the tourism sector. Minister of Business Honorable Imraj Rajkumar thanked Mullis for the development of the agency's work, which saw Guyana being recognized as a rising star in tourism destinations, both regionally and internationally.
Our tourism sector has developed over the few months Brian was in charge, and I would like to really thank him on behalf of the people of Guyana. We have won several awards through his diligence and guidance. Indeed, it is very sad for us to say goodbye to Brian. He has done so much for tourism in our country.
In his brief remarks, Mullis spoke about his journey as the director of the agency and its way forward.
The expectations of me were set pretty quickly, which aligned with my own when I was appointed as the director, or former director, I should say now. I was asked in so many diplomatic words to bring the country out of the relative unknown and into the global tourism marketplace, and to work myself out of a job as soon as possible by elevating the capacity of the GTA team and the deputy director to lead the organization forward. Mission accomplished and then some. I think the GTA has helped Guyana with its partners gain prominence and recognition, as we know, as a leading sustainable destination.
Chanjo was anonymously elected at the end of a rigorous 4-stage selection process. She is the first Indigenous woman to be appointed to lead the GTA in its 18-year history. Neola Damon, InfoHub.
In spite of the COVID-19 pandemic, the Guyana Nurses Association will still be recognizing nurses throughout the country by having communities stand in solidarity with frontline workers in the healthcare sector on May 12th. President of the Guyana Nurses Association, Cleopatra Barkai, is encouraging citizens to be part of the celebration of nurses and midwives in Guyana. This is in keeping with the WHO's annual observance of International Day of the Nurse.
We as an association want to take place on the 12th is a recognition for these achievements of Guyanese nurses. And so we're asking the ministry and other organization agencies to celebrate with us at 5 o'clock in the evening by doing one of the following: either by sounding of a siren, blowing of a car horn or vehicle horns, ringing of a bell, or the clapping of hands.
Organizations can also put up white flags for the day or distribute white ribbons in observance of the day, while citizens can adorn their homes and vehicles with white flags in recognition of nurses. Do remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, or difficulty breathing, please seek medical care early, but call that hotline first. That's all for today. Connect with us on our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. You can also subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Stay safe, sanitize. Goodbye for now.